Hello, my name's Dr. James Granger with Acupuncture and Injury in Marietta, Georgia. Just want to take some time to talk about addiction, particularly opiate addiction, some of the things that can be done for it, and things that aren't being done for it. Medications that can be used for opiate dependence include methadone, numerous buprenorphine formulations, which we use here in our office, like Suboxone, Sublocade, Brixadi, Subutex. There's also naltrexone, uh, medications that we don't use here. Um, One of the big things is the stigma with opiate addiction. There are a lot of stereotypes out there which are uh, obviously negative. We don't advertise addiction in our name. We say acupuncture and injury to help people avoid that stigma when they come in for treatment. I feel it's better than going to the addiction center or the treatment center or the rehab or recovery, although we still offer the same buprenorphine medication that you can get in facilities with the addiction in their name. One thing that I really want to talk about today that's kind of not spoken about publicly much is the problem of what leads to addiction. Prescription medications are a big part of that. Um, a large number of my patients over the years have been self-referral, um, which causes me some concerns because their primary care providers aren't picking up on the opiate addiction, whether or not screening for it. And a lot of times I see that they're actually causing it. What I mean by that is a scenario such as a patient who has low back pain. Their insurance won't cover the physical therapy. They're not really a surgical candidate. Maybe an MRI gets done and you find disc herniation or disc degeneration on the MRI. A large, well, significant number, percentage of those findings are in asymptomatic patients, so you really have to ask, is that really the cause of the patient's back pain? So what I like to encourage people to do is do the least invasive stuff first. Obviously, acupuncture is what we use here, as well as some physiotherapy methods. Um, One thing I like to tell people about acupuncture is nobody's ever overdosed from acupuncture. But what happens too many times in the primary care setting is a patient is given a tramadol if the ibuprofen's not working, and then when the tramadol doesn't work, they're given a short prescription of an opiate, and when that doesn't relieve the patient's pain, they're sent off to pain management, and then the patient's on the road to physical dependence and possibly addiction. Quite simply, you can't get addicted to opiates if you never use them or aren't prescribed them. Um, so what I like to do is encourage people to use other modalities such as chiropractic, acupuncture, physiotherapy before going down that road, particularly when they're marginal or questionable findings on your MRI, because just because a disc herniation is there does not necessarily mean that's the cause of your pain. Um, I'm not saying all this to discredit primary care providers because their hands are often tied by insurance companies that won't pay for those therapies. Acupuncture, Medicare will only cover it for low back pain. I have opinions about that. That's for another day. But what I would encourage people to do is take control of your health. Don't let the fact that you've got to come out of pocket for services impede you from doing the least invasive thing first, because it can save you a lot of trouble down the road from having issues with opiate dependence, all the side effects of medication. Again, let me reiterate, you won't find anybody overdosing from chiropractic or acupuncture, where the medications have a long list of side effects. In future videos, we'll talk about the differences and the different medications that are used for opiate addiction, differences between opiate addiction and dependence, because there's a distinct difference that needs to be understood there. And also maybe in later videos we'll talk about some of the social stigmas that go along with prescribed opiate use and some of the things I've seen as far as opiates being overprescribed, let's say. Um, just want to reiterate again, there is help out there. It's not always in the name of the facility like ours. We are here to help with addiction. Um, Again, most of my patients are self-referral. Don't be afraid to ask for help or find help for a loved one if you or they need the help. This can also be difficult with your insurance directories because they don't always list who provides those services. Word of mouth is a really good source for finding facilities that provide treatment. There are directories for some of the medications like Suboxone and Sublocade. They have provider directories. SAMHSA.gov has a provider directory for providers that provide buprenorphine services to treat opiate use disorder. Follow us below for more videos in the future. We'll see you soon.